Hi, everyone. Welcome to Mama Wears Athleisure. I am your host, Mariela de Santiago, a first-time mom. We focus on all things mom with tips to help make life easier and more organized for all you mamas out there. Hi, everyone. Today we're going to talk about prolapse. So we have Ariel Gallop from Restore Pelvic Therapy with us.
Hi, I'm Ariel Gallop. I am a pelvic floor physical therapist, so I treat everything related to the pelvis. So urinary issues like leakage, bowel issues like constipation, pain with intimacy, SI pain, pubic symphysis pain, anyone who's pregnant and postpartum, and then prolapse. So that's my thing.
Well, prolapse, what is it? Let's talk about that.
So prolapse, I think prolapse gets a scary reputation. I think if you Google it, it sounds scarier than it actually is. But what it truly is that the organs are sitting lower in the pelvis than they typically would. So that could be the bladder, that could be the bowels, that could be the uterus. I think most often I would say I see the bladder sitting lower, but what that means is that there's some kind of tissue injury or tissue damage that happens, and they aren't sitting as high as we would like them to. So people will sometimes notice that they feel heaviness or pressure. Sometimes people will say they feel a bulge in their vagina or like they're sitting on a tennis ball. There are other symptoms like leakage or recurrent UTIs if they're older, but the main thing is pressure and heaviness. And I think the main causes that I see a lot of postpartum prolapse, which can be hormonal. When the hormones change, they get more laxity in the ligaments that support those organs. So then they will sit lower. Sometimes injury during birth and a chronic constipation or coughing, bearing down, something like that. Occasionally I see lifters that have it, but I do often see it postpartum.
So you're right that when you Google it, you basically get your insides are falling out.
And I think the way that I try to explain it most of the time, and it depends on the organ, but it is often the bladder pressing against the vaginal wall, or it can be the uterus coming and sitting lower. So sometimes people do see that in their vaginal canal, but most often it's that something is pushing against the vaginal canal, and then you're seeing that pushed forward part, whether that's the anterior part or the posterior part of the pelvic floor.
So, given all of that, how does pregnancy or having had children affect this? What does it mean? Like, if you have had children or are pregnant, does it basically mean that your chances of having prolapse increase?
It doesn't necessarily mean you're destined to have prolapse, but it is very common. I don't say that to brush off the symptoms or to brush off prolapse, but more just to say, okay, that is normal. And if you do experience it, it's not the end of the world, and there are things that we can do for it. But it is very common postpartum, especially after a second or a third baby, to start to notice more prolapse. There are things that we can do for it during pregnancy and during that postpartum phase to prevent it from worsening and to improve those symptoms. But it is very common postpartum. And I think a large part of that is the hormone changes, and then sometimes how people push when they're giving birth, and then how soon they jump back into activity postpartum.
You always have all these variables with anything related to pelvic
I
floor,
know.
right?
We always say it depends.
Well, because it's true. Not everyone is the same. So it always does
Yeah,
depend.
it does depend.
I feel like you already kind of talked about symptoms. Are there any other symptoms that we should be aware of that would maybe make somebody think like, oh, maybe I fall in that category?
Definitely. So I think that the main ones that they come in for is they notice, okay, I have that heaviness and I have that pressure. But sometimes they will have leakage when they go from sitting to standing, or they'll have a difficult time feeling empty, whether that's peeing or pooping. So sometimes they'll notice, oh, if I wiggle in this certain way, a little more comes out. Or if I push on this one area, a little more comes out. So that can assist the body in emptying, and it is often helping to kind of move that organ back into its original resting position to help empty better. I think those are the main symptoms.
And given that you treat prolapse or help treat it, then I'm going to assume it is treatable.
It is definitely treatable. Yes, it totally is. I want everyone, if you walk away with one thing, to know it's very treatable. pelvic PT, I believe, should be the first line of defense because we can do a lot of things to help with it. A lot of it is strengthening. So I know you've had people on to talk about Kegels, and sometimes that's part of it, and sometimes it's not part of it, but often we're strengthening the pelvic floor and the hip muscles and the core muscles. We're also kind of retraining posture because if you are in a slouched position, that puts more pressure on those organs. So we're working on strengthening the postural muscles. And then breathing mechanics are really important. It's kind of a boring thing for people to work on, but we talk a lot about breathing, about, okay, when you're picking up something heavy, make sure you're breathing out as you do it. If you're picking up your baby, make sure you have them close to your body. Get down low with them when you're picking something heavy up and then stand up with it. We talk about hip hinging, and there are a lot of things that pelvic PT can do in a very non-invasive way to help prevent worsening, improve prolapse, and also manage symptoms. Because sometimes people will have symptoms worse at the end of the day, and I can say, okay, well, get into this stretch or try lying down in this way, and that can help decrease what you're feeling. And that's not a forever solution, but it's while we're working on it to manage it so you don't feel it as much. There are other things you can do to treat it also. So there's a medical device called a pessary that you can insert vaginally. A lot of physicians can fit you for those. Some pelvic PTs can fit you for that. And that helps support the organs in and kind of helps put them back in the place where they belong. Some people use those forever, and some people use them while they're doing things that are aggravating, like running or jumping on a trampoline. If you know you're going to go to that jumping gym, sometimes they wear those. Some people like pessaries, some people don't like them, but it is an option. And then there's surgery. And surgery, it does help if it is warranted. I think there are some people where it is very beneficial. I think that pelvic PT can be the first line of defense of, okay, come in, let's treat you or teach you how to improve the strength, improve your coordination, improve your breathing, because surgery is great and it does kind of put everything back together where we want it, but it doesn't fix the cause of it. And if you're not working on the cause of it, then likely you'll have a relapse. So I try to tell people to come into pelvic PT, even if they're going to have surgery, to help them have better outcomes after. But moral of the story is yes, you can definitely help with prolapse, and PT is definitely shown in the research to improve it.
Hi, everyone. It's your host, Mariella. I wanted to thank you for listening and share some ways to show your continued support. You can rate and review on Apple Podcasts or Spotify. Share the show with friends and family. Buy me a coffee to help with the financial cost of running a podcast. Follow me on Instagram at Mama Wears Athleisure. And finally, subscribe to my newsletter. Thank you for listening. You probably saw me fix my posture as you were talking about posture.
Me too. Always.
When I was in the classroom, I used to have one of those like big yoga balls as my chair because it
Yeah.
would force me to sit up.
That is so smart. It's really awkward when I am telling someone, okay, when you're breastfeeding or chest feeding, you need to be in a better position while I'm also hunched over. But it does impact things. So
it does. And you did mention, so pelvic floor does help with so much.
yeah.
I went to my first pelvic floor session and all I
Yay.
needed was really one, but it was just more to like figure out like, okay, am I doing okay? This is
Yeah.
kind of what I like taught myself with being able to get like feeling back in my C-section scar area. So it really
Oh, awesome.
is nice to know that you may only need one session,
Yeah.
or if you do need more than that, then you'll know. And you'll know if you, in this situation, if you need surgery or not, depending on how bad your situation is.
Yeah.
So,
It doesn't always need to be a forever thing. I mean, the goal is that it's not a forever thing. And I really try to be very honest with people of this is the best kind of outcome, but also everyone is different. And this might not be the biggest thing in somebody's life. It might be that this is something that bothers them, but isn't their number one priority. Their kid is probably their number one priority. So it's often a lot of, okay, let me see you. Let's give you a bunch of exercises, get really good at those. And when you're good at those, we'll make them harder. And I'm always here if you have questions or if something happens, you can get in. But I think it is important that you know and that everyone knows that PT doesn't need to be an every single week thing. It can be, okay, I'm going to see you every couple weeks, and then we're going to taper that off.
Can it be left untreated? Like, if so, what would be the side effects, the long-term side effects of not treating something like this? Because people are busy, they don't have the time. And if you do have kids at home with you, a lot of PTs do allow kids to come in. I think that's something
Yes.
we aren't really used to hearing because you don't take your kid to your dentist appointment. Like that would just sound dangerous, I think, in my mind. Like,
I think I love when people bring their kids in because I think A, it makes it easier for them, but B, I can also train them in really functional things of, okay, you're picking up this baby. Okay, you're picking up this 2-year-old and you're getting symptoms with it. Let's figure out why and let's change that. Let's get you in the position where you normally have it and change things. And let's change your posture and change your breathing and change what you're doing with your pelvic floor. So I think it's really helpful to have the kids and I love having them. I think it's really fun. But if you don't have the time and this is not your number one thing, that's totally okay. I don't want to scare people, but I do think it often gets worse. If you have a prolapse and you're not managing it, you will probably be managing it later. So I think the sooner you start, the less severe it is, and the faster you'll get the results. It doesn't mean you can't. Like, I definitely have people where they say, oh, yeah, I know I've had this for 3 or 4, 10 years, 20 years. We can still work on it, but it won't progress if you work on it now.
my last question, do you have any other tips, suggestions, or recommendations?
What do I think I would love if everyone knew that if you saw a PT during pregnancy, they would give you some strengthening exercises. They can teach you labor and birth positions. They can teach you how to push more appropriately to help decrease your risk of getting a prolapse, and then also give you exercises for that postpartum period. I think PTs are starting to see people sooner and sooner. Like, yes, you get the 6-week clearance that you can start returning to all your activities, but there are things you can do sooner. So you can get in with a PT sooner, but you can also, I try to give people some exercises for those first few weeks of, okay, here's some breathing, here's some stretching that is totally safe to do. So I think know that PT can be used before pregnancy or during pregnancy to help with preventing prolapse or treating if you have a prolapse. And you can also get in at that 6-week mark, get an internal pelvic exam and see, okay, what's going on and progress things. So that's one. Exhale with exertion. If you're picking up that kid, you're picking up that stroller, whatever you're doing, breathe out while you're doing it because that'll decrease pressure on your pelvic floor. And then also don't blame yourself. I think a lot of people feel like, what did I do to cause this prolapse? And sometimes it's not you. If you have hypermobility or some of it is hormonal, it's not what you're doing. You're doing the best that you can. So don't blame yourself and then just do what you can to work on it.
With the breathing part, like the exhaling whenever you're doing that hard part, it just kind of goes with the fitness piece, right? When you go into a workout class and you're doing biceps, they always tell you to exhale when you're curling your bicep because that's like the heavy part. So it kind of ties in with that. Like, just think about what you're doing in a fitness class and when they tell you to exhale, or you're always reminded, don't hold your breath. So it sounds like it's very similar.
It is very similar. And it is, it's the same principle. Decrease the pressure on the pelvic floor, have better mechanics. It helps give you more stability. So yes, it is exactly the same thing. So remember what they tell you at the gym.
Thank you. Thank you so much for all of this. I appreciate you coming on and sharing to talk about this fun topic. These are always fun.
Well, thank you so much for having me. I always love when I get to hang out with you.
The same. Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.